Great. So the recording has begun. Yes, just making sure that it is going. Yes. All right. So everyone's going to be muted, as I mentioned, during our presentation. We will go through and share some information, and then there will be time for question and answers at the end. We're going to have folks enter their questions into the chat tool. And we just want to note there's going to be a lot of information shared today. Again, we will make this all available to you going forward, and we'll be continuing to share information into the new year, and will continue to be available for questions and support. So yeah, with that, I will get started. Okay, so our agenda today will give a brief overview of Health Plan of San Mateo. We're going to go over the steps that a provider should follow to see one of our members, including prior authorizations, checking member eligibility, our provider portals, and then importantly, billing and claims. And we will go over HPSM communications and support pathways, and then we will have time for questions and answers at the end of our presentation. All right, so let's dive right in. Many of you may be familiar with HPSM. HPSM is a managed care health plan that provides healthcare benefits to San Mateo County's underserved residents. We are what is known as a county organized health system per state designation. And so almost all Medi-Cal enrolled residents in San Mateo County are our members. And HPSM manages programs that provide healthcare to more than 147,000 San Mateo County residents, which is about 1 out of every 5 residents in the county. There are more than 20 languages spoken amongst our members. The most common are English, Spanish, Mandarin, Cantonese, Tagalog, and Arabic. HPSM has 4 coverage programs. The first is Medi-Cal. Eligibility for Medi-Cal is determined by the state of California based on income and other factors. And Medi-Cal members must live in San Mateo County to be eligible for HPSM Medi-Cal. We also have our Care Advantage product, which is for members who are eligible for both Medi-Cal as well as Medicare. Many Care Advantage members are elderly and or disabled and also have a low income. HealthWorks is a program that largely covers in-home support services workers and some other county employees. And then our ACE program is a locally funded healthcare program for low-income adults who do not qualify for Medi-Cal. And HPSM serves as the third-party administrator on behalf of San Mateo County for this program. And most services for ACE are provided by San Mateo County Health. So the majority of HPSM members are Medi-Cal members, about 78%. And important to note, only Medi-Cal members are eligible for ECM services. Okay, so now we want to go over the steps that a provider would follow to see an HPSM member. And the first step would be to receive or confirm an authorization for a member by fax. Next, providers would want to check member eligibility and then provide services to the member. After providing services, the provider would submit a claim and then confirm receipt of payment of that claim. And then finally resubmit an authorization when or if it's needed for that member. And we are going to go over each of these steps in more detail now. All right. So the first step we'll go over is authorization. And with that, I am going to pass the presenter baton over to my colleague, Gail. And hang on, Gail, let me unmute everybody so that you may speak. All right.
Thanks, Molly. Can everyone hear me?
I can, yes.
Perfect. Great. So I wanted to just highlight that enhanced care management is a new Medi-Cal benefit. Oh, thank you for that the slide. And that it's a comprehensive case management service for our highest needs members. So enhanced care management is high touch and in person and addresses both medical and social needs. For ECM, prior authorization is required for the initial start of service and the continuation of service. As mentioned in the slide, some services that you provide require prior authorization, and this prior authorization is a requirement to begin the service and for the continuation of service. The ECM provider, as well as another provider, so that could be a community case manager or a primary care provider, may submit a prior authorization request for ECM. It's important to know that you may receive an authorization notification letter for a member that you didn't request the services for. As a servicing provider, it's important to know that this prior authorization is a process that verifies that the service is medically necessary. Next slide, please. So HPSM is launching ECM to a specific group of members. So we have the first group, which is the members that are the existing members that you are already servicing that are receiving these ECM-like benefits. And so I consider this group as a grandfathered in to whole person care members, and they will be receiving a auto authorization on January 1st. And there were ECM transition notification letters that were sent to this specific group of members. And this notice notified them of this change and that there would be no change to case management that they are receiving, and it includes case management staff. Our hope is that there, as their current provider, that there has already been conversations with the members to further go through this change with them and explain what this change entails. It's also good to note that whole person care members that aren't engaged with a whole person care provider will also be auto authorized sometime in January. There will be a list of these members sent to ECM providers. So all of you, again, sometime in January. The second group is the newly eligible members. So these members will be loaded into HPSM's authorization system with a auth start date to be determined. And these are folks that are non-whole person care members that have been identified by HPSM to meet the population of focus criteria. And we'll be giving updates in January. For all other members, we are still working on setting up an authorization process, and there will be more information to come. And these all other members are members that don't fit in the groups that I had just mentioned. Next slide, please. So you will receive an authorization approval or denial letter by HPSM fax. So after making that request, this is the notice that you would receive in regards to the approval or the denial. Members receiving ECM that transitioned from whole person care, MSSP, or CCSP IOA, as mentioned earlier, will be automatically authorized, and the authorization period will be for 6 months. ECM providers will need to submit a prior authorization request prior to June 30th, because that's the auth end date for the first 6 months, should continued services be needed. And that could be identified by conducting a reassessment within the first 6 months. To request continued authorization of ECM, the provider, as mentioned, will need to complete a prior authorization form. And our CalAIM webpage will be updated with guidance by January 1st. And that page will be a key resource and tool to learn about how to submit a prior authorization request form, as well as the criteria for ECM and community supports, and all things CalAIM will be on that webpage. Next slide, please. If you submit a prior authorization for ECM and receive a denial letter, please transition the member out of services by the auth end date. Please follow best practices and contract for transitioning members out of case management. If you submit a prior auth for ECM and receive an approval letter, I would review that letter carefully, review the start and end date. Services can begin on auth start date, and you would contact the member and proceed with next steps to begin services. And that is it for my part.
Okay, great. Thank you, Gail, for that. Okay. So the next step in the process to see a member, once you have received authorization, would be to check the member's eligibility. Checking eligibility verifies that the patient is covered by HPSM at the time of your service. As mentioned previously, eligibility for Medi-Cal is determined at the state level. If the patient is not covered on the date of service, HPSM will not be able to reimburse the provider. And eligibility frequently changes monthly. It can also change more frequently. So the best practice that we recommend is to check eligibility prior to every visit or service to ensure that you are eligible for payment on that date and that the member is still active with HPSM. There are a couple ways to check member eligibility. The one that we recommend and that we believe is easiest is to register for our provider portal. The link is here and we will talk about it a little bit more later as well. You can check eligibility on that portal. If ever that portal is not available or you're not able to access it, there are also a couple of options to check eligibility by phone. HPSM has 2 online portals for you to use. The first, as mentioned, will allow you to check member eligibility and also submit claims online. We also have an e-reports portal that is a login that will allow you to view your claims remittance advice, which is the detail on claims payment. You can log in or register and log in to the provider portal on our website. And if you need any assistance with setting up the portal or have questions about how to use it, you can contact our claims department with the information here. We also do have some additional resources on our website for how to check eligibility, including a video. So we are happy to share those as well. Our e-reports registration is also available on our website. This will allow you to view your claims payment detail. Okay, so once you've verified member eligibility and you see that the member is still active with HPSM on the date of service, you can go ahead and provide services to the member. And then once you provide services, you will want to submit a claim. There are a couple ways to submit claims to HPSM. You can work with the clearinghouse. HPSM is set up with Office Ally and Caperio as clearinghouses. There are also some other clearinghouses that may work with those. So if you have a question about that, feel free to send that to us and we can look into that for you. You may also use our provider portal, which is also called eHealth Suite. eHealth Suite is a function within the provider portal that allows providers to submit claims on the CMS 1500 form. Finally, you can submit paper claims to HPSM. We do recommend submitting claims through clearinghouse or through our provider portal for quicker processing and less chance of errors. But we are able to accept claims by mail as well. And then some of you may also be submitting a monthly encounter report, and more information on that will be shared individually as needed. Okay, so for ECM providers, claims are expected to be submitted within 30 days from the date of service in order to qualify for the full approved payment amount. Claims received beyond that time frame will be prorated according to our claims payment timelines, which can be found on the slide and in our provider manual. There may be some individual nuances and differences for different providers in this group, which you may receive separate follow-up on from our team. Some tips on submitting your claims successfully to HPSM. If you do submit your claims on paper, we do not accept handwritten claims. So please make sure they are typewritten. Even better, submitting them electronically will help to prevent errors and make sure that they are processed more quickly. You can also enroll in EFT to ensure that you receive your funds direct deposited to your account. And that also helps to speed up the time with which you'll receive your payments. Claims may be suspended or denied when necessary data fields on the claim form are incomplete or incorrect. We do have a resource on our website which reviews which categories or which fields of the claim form are required by HPSM. And then for the monthly encounter report, incomplete or incorrect fields will require correction and resubmission of the report. And please ensure PGP or WinZip encryption prior to sending that report over to HPSM. So for coding on claims, when you receive an ECM authorization for a member, it will cover all relevant ECM codes. And please reference this DHCS resource that's linked here for coding information. And again, we will send out this presentation and recording after this, and so you'll have this link handy. Common billing errors to be aware of that may cause issues with your claims paying. The first one is not entering the member's correct member ID number. And so all HPSM members have a member ID, which is very important for checking their eligibility and submitting their claims. When you receive a member, you can get their member ID from their HPSM member ID card. You can also identify it on the provider portal using other identifying information for the member. Not using appropriate coding can be an issue. So for diagnosis codes, ICD-10 codes are required. And a reminder, prior authorization is needed for ECM services. So not having a prior authorization on file would cause the claims to deny. And then finally, we have here some notes on ensuring that the NPI is listed correctly in the claim form. NPI is National Provider Identification, and the rendering NPI is the identification number of the provider who's actually providing a service, as opposed to the billing NPI, which may be different and may be the NPI of an organization. So making sure that those are entered in the correct place on the claim form. If you have questions about this or would like a tutorial of viewing the form, we're happy to set that up later in the year. All right. So once you submit a claim form, the next step would be to confirm receipt of payment. Hopefully, your claim will pay correctly. If for any reason your claim does not pay correctly, you believe there was an error, a portion of the claim was not paid, there are a couple ways to address that. If you have questions about why the claim was not paid, we will include information later on in this presentation for who to contact to clarify that. If the claim completely denied and you need to make a correction on the claim, for example, billing code was incorrect, modifier was left off, anything like that, that caused the claim to completely deny, then you would want to resubmit a new corrected claim through the standard process, so through the clearinghouse or through the provider portal, as previously discussed. If the claim partially paid, however, so perhaps it paid but not the full amount it should have paid because of an error on the form, then you would want to submit a claim correction form, which is a specific form that HPSM has that can be submitted by mail or fax along with a copy of the corrected claim form. So the claims correction request form is linked here. It can be found on our website. That form allows you to note what needs to be changed on the claim, and then you would submit a new copy of the claim and send it in by fax or mail. You could also use this process when or if you need to report overpayments. For example, you billed for a service in excess, or if you're requesting reimbursement for a claim that was originally denied as a duplicate. And so we do recommend keeping this flowchart for future use as needed. A note on balance billing. So balance billing of members is prohibited by law. Providers who offer services to Medi-Cal and Care Advantage members cannot balance bill for any cost sharing not related to the member's share of cost, which includes deductibles, co-insurance, co-payment, and non-covered charges. Okay, so the final step here would be to resubmit an authorization when or if it is needed for the member in question. And then you have completed the life cycle of seeing an HPSM member. And so with that, we just wanted to cover a few other topics that'll be helpful for you all as you join the network. So HPSM's modes of communication. There are several ways that we communicate with providers. One of the main ones is on our website. So we do encourage you to visit our website. There's a wealth of resources there and information about HPSM. One of those is our provider manual. And that is a great place to go if you ever have a question about a policy as it relates to providers. It's a great place to search where we have a lot of information about our processes. We also send out fax and email notifications with important updates and information for our provider network. We have quarterly newsletters, and then we also send out mailings, and we will have webinars such as the one today, and additional webinars on various topics throughout the year. do want to highlight language access services. HPSM members have a right to receive interpretation services for their language. And to that end, HPSM provides 24/7 telephonic and video interpreter services at no cost to the member or the provider. So we have more than 200 languages available, including ASL. They are available on demand or by appointment. And you can view more information on how to access interpreter services at this link to our website. All right, so with that, we wanted to review the contacts at HPSM that you would reach for various types of questions. And so again, this is a good slide to keep handy in the future. So for how to submit a claim, why a claim denied, or claims corrections, you would contact our claims department. That's the contact information here. For questions about existing authorizations, you would want to contact our utilization management department at the phone number listed there. And then for questions about credentialing, your contract, and rates, you would want to contact our provider services department by email. And for any additional programmatic questions or escalated issue resolution, any issues you have difficulty resolving, you may contact our programs, strategic programs and partnerships team at the email address listed there. All right, and with that, we are just about at the halfway point of our meeting. So we do have some time to answer questions. And we're going to ask folks to enter their questions into the meeting chat tool, which will allow us to record all those and make sure that we follow up with you all with any answers that we are not able to get to today. So with that, please feel free to begin entering your questions into the chat. Okay, all right, I see one question coming in. So I'm going to actually unmute folks so that others on my team can also chime in. Okay, so the question I see here is authorization a one-time thing? And the general answer to that is, I'm going to go with no. It can be more than one time activity. But Gail, I don't know if you want to take a stab at that one or if we should take that as a follow-up.
No, I'm happy to take a stab. Thanks, Molly, and good question. It is not a one-time thing. It is needed or required for continuation of services and to begin services for folks that are not whole person care, as mentioned, and also for the folks that aren't found to meet the population of focus criteria per HPSM's or per our monthly eligibility list.
Thanks, Gail. And I see an earlier question, which I believe Gary addressed. Is the eligibility portal always up to date? And Gary is the expert on our eligibility portal, but by my understanding, it is up to date to the extent that HPSM has up-to-date information. So the state transmits eligibility information to us via that portal, and so that is the source of truth for HPSM and for providers. Who are all the ECM providers? Gail, I'm not sure if we have a list or if we're able to share that now, if we should just follow up with that via email.
I think we can, I would recommend confirming our list of providers via email, as it sounds like there's still some folks still going through the contracting process, but the hope would be that the current list of ECM-like providers, IOA, whole person care, bridges to wellness, and I think I accidentally hit that, an MSSP or aging and adult could or will be our providers.
Okay, great, thank you. Okay, the next question I see is, can you speak to what member information points will be required to submit a PA through the portal? And so I did want to note, currently, unfortunately, we don't have the ability to submit prior authorization through the portal. So claims can be submitted through the portal, but prior authorizations are still completed by fax. Gail, correct me if I'm wrong for this specific group, since I know they have some specific nuances.
That's correct. So those prior auth requests would be submitted by fax. And our CalAIM webpage or landing page by January 1st will have all the guidance needed for submission and requesting for ECM.
Yeah, so I think on specifically what member information will be needed, will that be addressed kind of separately, Gail?
So it sounds like the member information, I'm also trying to go back to that question, but that'll all be. So are you talking about, Jenna, what information is needed in the prior auth request?
Yes, exactly. Just kind of what demographic needs, kind of what, you know, general information we should be prepared.
Don't forget that Wednesday I have company over. Acuérdense que el miércoles tengo visitas.
Oh, okay. Yeah, and I'm gonna
work people.
I think we have someone accidentally unmuted.
I'm having a work event.
Let me mute everyone again. Oh wait, Gail can't speak.
Yeah.
Yeah.
Oh, hang on. I think I could override mute somebody. Okay. Sorry.
Okay, I'm good. Thanks, Molly, and no worries. Great question, Jenna. So yeah, as mentioned, the CalAIM webpage will have that. It'll link to our prior auth request form, but you know, the member's last name, the member's first name, their address, phone number, member ID, date of birth, age, things of that nature will be required. Oh, and most importantly, the primary diagnosis code is also going to be required in the description. But there'll be, again, specific guidance for that.
Okay, great. Okay, so the next question I see is, can patients be authorized while insurance is pending, e.g. waiting on inter-county transfer? So I'll let you chime in on that, Gail, but generally, no. A member would need to be eligible with HPSM. And so the source of truth for that would be the provider portal. But correct me, Gail, if that's
Yep, that's correct. Thanks, Molly.
Yes, so there may be cases where a member is active on Medi-Cal, but they actually need to be eligible through HPSM. Yes. Okay, next question is, just to clarify, the authorization for grandfathered clients is 6 months. For new ECM clients, will it also be 6 months?
Yeah, happy to take that one. For new ECM clients, that would be a 12-month authorization period.
Okay, great. I'm going to skip ahead and go back to the next one because this looks like a follow-up to our previous question. Eligible or active with HPSM. And I realize we use interchangeable language. So eligible or active, one or the same, essentially just showing that the member is still has active coverage and or is eligible in Great HPSM. Which can be confirmed on our provider portal. Hopefully that. All right. Next question, is the monthly reporting done by administrative staff or care managers? I'm not sure if we have the answer to this one right now. Does anyone else from our team want to chime in on this one, or should we take it as a follow-up? Okay, we may need to take this one as a follow-up, and we will look into this and then send out the response. All right, any other questions at this point? Okay, well, I'm not seeing any other entered at the moment. You know, as Gail mentioned, this is a new benefit, and we are thrilled to have you all joining our network. And new additional questions will certainly arise during the transition. All of these processes will be effective as of January 1st, and we will continue to be available to answer questions and support this transition into the new year. And so thank you all for joining today. We will send out this recording as well as any follow-ups to questions we weren't able to answer today. And with that, we wish everybody a happy holidays and good start to the new year. And would anyone else from the HPSM team like to add any closing notes?
I do. This is Gail again. Thank you all for joining us. We know this is also new, but really appreciate the partnership and serving our highest needs members. So look forward to checking in some more, and happy holidays.